The function of the hand and wrist is really based on the function of the whole of the upper limb. So the idea of the shoulder and elbow is to position the hand in space. Then the movements of the wrist and hand are designed to optimally configure the hand so that you can grasp, use things gently, pick things up, or store them in their hand with your grip. There are really two common types of injuries in the hand and wrist in winter sports, and it's really important to understand how we fall. Interestingly, we've done some research recently in Bath looking at that. Now, as you know, when you fall, you naturally put your hands up because you want to protect your head from being injured. What you have to do is cock the wrist back, otherwise you fall on your fingers. So if you fall on your fingers, you tend to get fractures of the little joints or you dislocate them. If you can get your wrist back enough, you fall on your wrist, and then you've got a nice padded area to absorb the energy. But if you fall really heavily, particularly on hard snow or ice, and often this is just walking about, either in the winter here or in a winter resort, then you can break your wrist or you can suffer a fracture around the elbow. In our clinics in the winter, we see many more wrist and hand injuries than we do in the summer, and especially people coming back from the Alps, having done their winter sports and fallen over. The wrist and hand are probably the most vulnerable sites of injury because they're the ones that are most out and forwards, and they're the ones that protect the rest of you when you fall. So as I said, when you fall, you put your hand out to protect yourself, and there are many mechanisms designed to prevent you suffering injuries. So you have to be particularly careful of your fingers and hand, but you're designed over many millennia to optimize this so that in fact when you fall, most of the time you will be okay, but it's when you're suddenly not expecting it, you're caught out. Often when you fall with your hand behind you, your arm's a bit stiffer, and then you're more likely to suffer a fracture of the wrist or injury to the fingers. When comparing skiing and snowboarding, there's really quite a different pattern from injury as you'd expect. Snowboarding is higher risk because then people tend to fall over more and often fall more quickly from a height. The snowboarders are more at risk often on the flatter slopes, and then you fall over, your whole body goes over, whereas the skiers tend to fall more on the steeper slopes, so you haven't got so far often to fall. The snowboarders put their hands out to protect them and they break their wrists, and that's the common injury we see, wrist fractures in snowboarders. Skiers, they don't tend to break their wrist or their fingers. What they tend to do is to injure the ligament of their thumb here. So as they fall over, they've got the ski pole in there and that pushes that back and that can tear that ligament. Interesting, that's an injury that's often underestimated in its severity. People are reassured that it's just a minor injury, a sprain, but in fact it can be more serious and can give some long-term problems. The terms sprain and strain are often used for injuries that people suffer. They're very much interchangeable and a different individual will use them in a different way. In the main, a sprain is tending to refer to a ligament injury and a strain to a muscle injury. And what we mean by that is a ligament is something that restrains a joint and stops it going too far. So in your thumb, it doesn't open further than this because it's got a ligament here so that when you push, that stops you. If you fall on that and you get a partial tear, that would be a sprain. We'd expect it to recover. It'll be a nuisance. A strain, you'd probably refer to one of the muscles, such as in the forearm, that you might have stretched a bit far, and again, you'd expect that to settle. When you're taking part in winter sports, then for skiers, their commonest injury is to their thumb, and there's not an awful lot they can do. For snowboarders, there's very good evidence that wearing a wrist guard helps. If you don't have any protective gloves, then obviously make sure that you are going to reduce your chance of slipping over, so wear shoes with good grips. Be aware where it's going to be particularly risky, and if it's slippy steps or a slope, you take that extra bit of care. But even having said that, we all know that you go out, it's nothing very obvious, and suddenly, bang, you've fallen over. And that's why really you want to have a little bit of protection. So some form of protective glove is very valuable. When you've suffered an injury to the wrist and hand, you'd always think this is going to be agony, but sometimes it isn't. We see people who've had fractures of the wrist that have been overlooked because they haven't been in that much pain. I think it's often a matter of using common sense. So plainly, if it's very painful, then you need to seek help. and you should go to see a local doctor either where you are abroad or in England. If it's not too bad, but it's not really settling in the way you expect in the first 5 to 7 days, then you should seek help. Most of these injuries can be treated safely for up to about 2 weeks, but after that it becomes more difficult. So if it's really not settling quite quickly in the way you'd expect, you're better off seeing someone, and if it's nothing very much, being reassured, but you don't want to miss a significant injury. If you've suffered an injury, it will depend on what injury you've had as to what treatment you need. So if it's just a sprain or a strain, we'd give advice typically about getting going. In the past, we used to get people to immobilize their wrist or hand for a long period, and actually that's not really very helpful. They get stiffer and recover more slowly. If you've had a dislocation, normally that can be put back, and again people can get going early. If you suffered a fracture, then almost certainly some period of immobilization will be needed, and for some fractures surgery may be needed to get a satisfactory long-term result.